Hi, I'm Dr. Scott McIntosh, Associate Director of the Smoking Research Program and Director of the Greater Rochester Area Tobacco Cessation Center. The American Cancer Society started the Great American Smokeout in the 70s and 80s and encouraged people to use the day to quit for 24 hours. And research shows if you quit for 24 hours, you're doubling your chances of quitting successfully in the future. The most important behavioral strategy that one can do is to set a quit date. So something like the Great American Smokeout or quitting for 24 hours may not be someone ready to set a quit date, but that practice that they get will help them learn what's called habit breaking. And if they can make it 24 hours, they'll learn what it was that triggered them to smoke again, and then they'll be serious about quitting. And setting a quit date should usually be 2 to 4 weeks in the future, but some people can quit right away, so it's very individualized. To successfully quit, there are 3 things that can double your chances for quitting. Getting social support, and that can be from your physician, and we train physicians in our local area actually on how to counsel and advise and refer to the state quit line. Another strategy is learning new skills. Stress is one of the #1 reasons people go back to smoking, and when they learn new skills to deal with stress, then that's going to help them maintain their abstinence and quit for good. And then there are 7 really good frontline cessation medications, some by prescription, such as Chantix, Zyban, the nicotine inhaler, the nicotine spray. And then over the counter, people can get the nicotine lozenge, the patch, or the gum. And the New York State Quit Line does provide both social support, proactive counseling, and 2 free weeks of either the patch or the gum. It's open as a reactive quit line anytime people want to call and get advice on how to quit, questions they may have about quitting attempts. Right away after people quit, the carbon monoxide starts to leave their body, and carbon monoxide is one of the causes of cardiovascular problems, and your breath starts to smell better. Your stress might go up when you're going through withdrawal symptoms, and we call that recovery symptoms. In fact, lung function may feel like it's getting worse, but it gets better and then gets a lot better. So we encourage people to see those as recovery symptoms. Long term, after 10 years, one's risk of lung cancer gets cut in half. And after 15 years of being a non-smoker, the risk for heart attack is the same as someone who's never smoked. The price of cigarettes is a strong motivator to get people to quit smoking. And whenever a price goes up, either because the tobacco company quietly raises the prices or because there's a new tax, etc., there's an immediately observable decrease in smoking. At the Greater Rochester Area Tobacco Cessation Center, we train physicians and office staff in 5-county area to counsel their patients. And since cost is such an important issue, we provide materials like this, which is called a cost of smoking calculator. And you can see, based on how much you smoke, and the price of your cigarettes, how much you'll save. And that can be by the day, week, month, etc. For example, after 1 month, a pack-a-day smoker will save $250. So even though smoking cessation medications may cost a lot, within 1 month, more than enough is saved from not smoking to pay for the smoking cessation. Currently, the state was forced to reduce its funding for the cessation centers throughout the state and for the state quit line and other tobacco control partners. And it's so important to restore that funding and in fact increase it because with more resources and more avenues to evidence-based treatment for smokers, the better chance we have of ending this epidemic. Anyone who's interested in quitting now or finding out more should call the New York State Quit Line at 1-866-NY-QUITS or go to their website at nysmokefree.com or talk to your physician. Both those mechanisms get you to the evidence-based treatment that's funded by our state and available, and we need to get that word out there more because that's the fastest way for someone to find out the best way to quit.